Good day, friends. Namaskar, dosto. I am Dr. Sanjay Kalra, and you are watching Dr. KK's Med Talks with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 855वां 855th एपिसोड है. We are friendly, we are familiar, and in that familiar pattern, let's have the headlines for today. We are all aware of the burden of diabetes. 500 मिलियन से ज़्यादा लोग हैं पूरी दुनिया में जो डायबिटीज के साथ जीते हैं. But now the World Health Organization has said that there is a 3% increase in diabetes mortality rates over the past 10 years. Diabetes तो बढ़ी रही है. Unfortunately, death due to diabetes has also increased by 3% over the past 10 years. And diabetes is occurring earlier and earlier. Younger and younger लोगों में diabetes होती जा रही है. A study has linked unhealthy dietary choices to 15 million cases of type 2 diabetes globally. तो जो 14 मिलियन लोग मतलब तकरीबन 1.5 करोड़ लोग जिन्हें डायबिटीज है उन्हें सिर्फ इसलिए हो रही है बिकॉज ऑफ अनहेल्दी डाइटरी चॉइसेस. चॉइसेस क्या होता है? वी नीड टू स्पीक अबाउट दैट. ये जो चॉइस है, जो मर्जी है, इज इट आवर चॉइस और इज इट फोर्स्ड अपॉन अस बाय समवन एल्स? Another choice we have is कि हम जल्दी उठते हैं, जल्दी सोते हैं या उलट करते हैं, late to bed and late to rise. And researchers have revealed that night owls, जो late जागते हैं, late उठते हैं, they are more likely to develop heart disease and type 2 diabetes as compared to early birds. Early birds means those who wake up early and go to bed early. And the key to overall well-being, चाहे blood pressure हो, चाहे diabetes हो, चाहे heart disease हो, या lipids हो, that is weight loss, weight maintenance. So with these headlines, let's go to our topic for today. A topic with a twist. Making India the diabetes care capital of the world. That's what we all want. We want to be known as the country जहाँ पे diabetes care सबसे बढ़िया दी जाती है, सबसे बढ़िया ली जाती है. But जिम्मेवारी किसकी है? Responsibility किसकी है? In our KK Med Talks, so many times we speak of rights and responsibilities, hukuk और जिम्मेवारियाँ. So today, let's see what the responsibilities of people living with diabetes are. And इसके लिए guest किसको बुलाएं? On Pharma Talks, let's invite Miss Farida Hussain, a flag bearer, a torch bearer of diabetes care in India. Warm welcome, madam.
Yes, thank you, Dr. Kalra. Thank you.
Farida ji and I, we've known each other for 2.5 decades now. And Farida ji has been right at the front in terms of fighting diabetes in India. She's a highly accomplished pharmaceutical professional, an impressive career of more than 30 years. So I promise her I won't tell her that, otherwise हमारी age का पता चलता है. She is currently the Chief Marketing Officer at USV Private Limited, one of India's most respected diabetes and cardiology companies. And she has also taught at MNIMS Mumbai. She has taught pharmaceutical marketing. She is well known for her strategic innovation and dedication, and her vast experience and expertise, along with excellence that she is so well known for. This has helped the healthcare industry become more efficient and become more effective. So warm welcome, madam.
Thank you so much, Dr. Kalra, for that very gracious introduction. Thank you.
There are so many people who are listening to you. Vinay Gupta ji, Dr. Vipin Bandula is a civil surgeon at Kangra in Himachal Pradesh. Dr. Ramesh Pal Singh Pawar is a 72-year young pediatrician from Saharanpur in Western UP. Ankit Ahuja ji, who is an industry leader in HR, he is logged in. Vinayak Sharma ji and Satyendra Singh ji bhi aapko greetings de rahe hain. And also Ayushi Gupta ji, senior doctor, Dr. Shubhlata Chatwal from Delhi, she is also logged in. And there's a stream of questions coming up for you. And one question comes up about affordability. This is from Mr. Ahuja. So he says, India is known for making good quality drugs and good quality affordable drugs. But is it possible to make these drugs more affordable? What can we do to ensure that?
Yes, so thank you for that question. And in fact, I'm glad that you have asked this question. The reason is that, many of the drugs which are available in our country today are affordable to the extent that we are, in fact, the prices of our oral anti-diabetics or diabetics are the lowest in the world. So that is one point that I must share with you. However, having said that, the problem in our country is that we have to pay out of pocket expenses. Everything is out of pocket. insurance is hardly there, and as a result of which we find the burden of even these lowest cost medicines which are available with us in India extremely high. And in our country, as we know that there are several people who are living below the poverty line, and not only those but lower middle class income people, and they definitely feel the pinch. Very good medicines are available to manage diabetes, which are extremely low cost, and they are as low cost, and they're good quality drugs, and they're as low cost as 2 rupees a tablet, or about say 4 rupees a day therapy. So in fact, if you talk to your doctors, they will support you in terms of ensuring that the economic burden is not very high when they prescribe these medicines for you. So I can only say that there are very good quality medicines available in our country at a most economical price.
What Farida ji is saying is right, क्योंकि हम जब अपने colleagues से बात करते हैं, whether they live in America or in Africa, उनके actually मुंह में पानी आता है when we tell them the cost of maybe atorvastatin and aspirin, when we tell them the cost of metformin or glipizide. These are drugs which are so economical, they just cannot believe when we tell them that this is the cost per day. And actually, Farida Hussain ji is one person who has spearheaded this. She continues to produce and market these very low cost drugs for us. हमारे साथ डॉक्टर विपिन बंडूला जी भी हैं, and he is a leader in public health. I'm sure, Dr. Bandula, if you have the chance, could you share the policies that the government has put in place, जो national programs हैं, how is it that we are able to provide low-cost medication to our patients? And we look forward to comments from everyone. Vinay Gupta sahab कहते हैं that we have surpassed China in population, and that means the number of people with diabetes is also going to go up. So your comments from a national perspective, ये अच्छी बात है, not so अच्छी बात है, what challenges does this bring for health, our increasing population?
Yeah, I think that is a real problem. And yesterday, yes, we came to know that India has become the most populous country in the world. And as you are rightly saying that, therefore the number of diabetics will also increase. And Dr. Kalra, you can also comment on this, because after COVID, I'm sure that you have seen a rise in the number of patients with people with diabetes more and more, and not only people with diabetes, but also people with pre-diabetes. And within say a short period of say 2 to 3 years, I think about 50 to 60% of them will get converted into diabetes. So this is a really an alarming situation, and therefore this topic is very pertinent, that how do we make India the diabetes care capital of the world, and what is the role of the patients? Because unless and until people with diabetes will not take ownership, this epidemic is just going to kind of go to any great lengths. So, Dr. Kalra, I think you should also kind of give your opinion as to how many patients have you seen increasing in diabetes, during this period of time, last few years.
Lots. We also welcome Raghav Chaudhary ji and Ashish Karan Sharma, and this wonderful person who goes by the name of Dude Book. ऐसे वाले नाम मुझे बड़े अच्छे लगते हैं. It makes me feel young also, the Dude Book and the kids. So welcome everyone to our show. And Anamika Nuji has logged in again. So what Farida ji is asking is, how do we become the diabetes care capital of the world? And how do the public, how do people living with diabetes take ownership? This is actually a challenge, because traditionally what has happened in our culture is we have had this, you can call it a dependency syndrome. Dependency means, let's say you call it a guru shishya syndrome. So the shishya is supposed to sit there and wait for the guru to decide what to do. A very paternalistic or a very hierarchical kind of a system used to prevail, still continues to prevail, and then you are dependent upon the doctor for everything. That may work in acute disease. जब आपको अचानक बीमारी होती है, चाहे वो खांसी जुकाम हो, चाहे वो हार्ट अटैक हो, that has come suddenly, then you can depend upon the doctor or nurse to decide what is to be done. But when it's a chronic disease, something that you have to live with throughout life, for everything you can't depend upon the doctor or the nurse. So you have to take charge. How will you take charge? So that's the first thing. We have to take charge. We have to understand that as members of the public, we have to take charge. The second thing is, charge ab kaise lein? So you have to self-empower yourself. You have to learn. जिस तरह से अब हम ऐनक पहनते हैं, I wear spectacles, Farida ji wears spectacles. So we have learned how to take care of our spectacles, how to clean them, right? Similarly, we have to learn how to self-manage. So the first thing is taking charge of oneself. Second thing is learning self-care management. So learning about self-care, empowerment. And जब इतना हम कर ही रहे हैं, while we are doing this, why don't we extend that goodwill to our family members and to the public at large? So if we want to be the diabetes care capital of the world, we need to take charge for ourselves and each and every fellow citizen. That would be the answer. Of course, it is much easier said than done, and lots of more questions coming in. Question from Kailash Chawlaji, who is a leading authority in patient awareness in New Delhi, and Shrishti Surveji. You've talked about COVID, and actually we've seen a great rise in COVID and in diabetes and in pre-diabetes after COVID. I also worry about the future. But the question to you is, what innovations have you seen coming in from Indian companies, from pharma companies over the past 2 or 3 decades?
So is this question related to diabetes or its management
Diabetes.
or
Diabetes and
its
diabetes
management?
management. Some
Yes.
unique things that we have done of which you can be justifiably proud.
Yeah. So in fact, because COVID forced us to kind of, think in it pushed us against the wall in order to kind of think in very innovative ways as to how do we keep in touch with our patients when, everything is kind of shut down. And as rightly said that, the patients had to take charge of their own selves during that COVID period. So a lot of innovations have come. And in fact, the digital technologies have kind of come, which is supporting in terms of self-management, as Dr. Kalra was kind of saying. So now you have so many digital, technologies available where you can just download the app and it will support you as to how to take care of your diabetes yourself. Number one. Number two is that there are a lot of patient education portals now available, wherein you go to the link and then you can learn about basics of diabetes and why educating yourself in diabetes is so very important. So there are modules available, there are MCQs, multiple choice questions available, and you can kind of get yourself more into it. So these are the innovations which are there in this education space, as well as in the connecting space and how to take care of yourself, as well as in the recent few years, I think about say 2 to 3 years, lot of good molecules have actually become more affordable. And I think that the Indian companies have done a really good job in order to make sure that all those expensive molecules that we had to treat are now being accessible and affordable to each and every one. So that also I can say is a type of an innovation only. And the third one I could
Carry on.
Sorry, and the third one I could add is that your virtual consultation. Nowadays, even if your follow-up visits for the doctors are so very important, and many of us miss those follow-up visits to the doctors just because of the lack of time, of the distance that you have to cover to meet your doctor, and so many other issues, because all of us are kind of so busy. And now virtual consultation is kind of come, which is again an innovation which can help you for a follow-up visit to keep in touch with your doctor and make sure that your condition is under control. So there are so many innovations which have kind of come, in this last 2-3 years, and glad about them. Yeah.
So, and most of these have been led by India actually, and now they may seem commonplace, but when COVID had come in, when it was so difficult to do these things, then it is Indian pharma that stepped up and led from the front actually. So what Farida ji is saying, affordable medicines, actually when you look at the inflation rates and you see how the rates of anti-diabetic drugs have gone up, you will find that they are relatively much cheaper than they were 20 years ago. The increase in prices is nowhere near the inflation rate. Second is virtual consultation, and then third is availability of educational material, online and offline both. Thank you coming your way from Dr. Utsav Sahu, who is a physician from North Delhi. And he says, I remember that USV was the first company to make dapagliflozin affordable for everyone.
Yes. Thank you.
Dr. Vipin Bandula points out that anti-diabetic medication is now available even at the PHC level, primary healthcare level.
Mm-hmm.
And insulin is available free of cost in his district in Kangra at the secondary and tertiary level. So thank you, Dr. Vipin, for joining the fight to make India the diabetes care capital of the world.
Yes.
Satvik Sharmaji and Dr. Utsav speak about other advances, and they speak about artificial intelligence. So what is this, Farida ji, artificial intelligence? How does it impact your work, and what future do you see for it in diabetes care?
So I think artificial intelligence, of course, everybody would have read about artificial intelligence, that how it is going to make the repetitive work that we do normally and how it is going to make it more easier. So in our space of people with diabetes, in our conditions of diabetes, I think one of the very important usage of artificial intelligence has been in the diagnosis of retinopathy. And so we know that diabetes causes retinopathy, which also causes blindness, and as a result of which each and every physician now, if you have that particular software and that hardware, you will be able to kind of detect retinopathy much earlier through the AI, through artificial intelligence, and as a result of which catch these patients much earlier so that they can be given the right kind of a treatment, or either kind of sent to the ophthalmologist at the right time. So it is going to and it is already impacting each and everybody's life, and for our people with diabetes it is definitely impacting in the right methodology. So one is this diagnosis, as I told you. Number two is also in terms of monitoring devices are there, which are also kind of going to use AI now in their monitoring systems in order to tell us that whether we are going up or whether we are under control or not under control. So there are a lot of exciting things which are going to happen, and we have to be prepared, and we have to change ourselves accordingly and see, and it will definitely improve the care in the future, and it is doing even now.
It's just like educating yourself on a continuous basis. And I myself, I struggle actually to learn some of these new media, but then I have to do it. Many times I am reminded of the people who used to, calculate using the abacus. And then when
Mm.
calculators came in, suddenly they became redundant because they
Yeah.
didn't know how to use calculators, but they were very good at using abacus. So I guess all of us, whether we are in pharma or in medicine or as members of the general public, we have to keep on learning that education is different. It's dynamic. So we have to learn these basic R's, reading, writing, and arithmetic, in different ways. Dr. Bandula reminds us that the government is working not only to make drugs available, that is, oral drugs and insulin, but it also helps in testing. So, free and mandatory testing is done for diabetes in pregnancy. Free and mandatory testing is done for diabetes in tuberculosis as well. And then they offer yoga camps in their primary health centers.
Yes.
Another comment, madam, for you, and then a question. So the comment is from Dr. Rameshpal Singh Pawar. Sir is using Glycomed GP 0.5, one tablet a day. HbA1c is perfect. He also follows regular diet and exercise. Actually, Dr. Pawar, sir, my father, he also used the same medication and he's happy with it, very happy with it. So that is two people saying thank you to Farida ji.
Thank you, sir.
Question from Amit Gupta साहब. वो पूछते हैं कि मैम, we are short of doctors in India. The number of doctors
Yes.
is not enough. We need diabetes educators,
Right.
just like Anganwadi workers or ASHA workers. So, any best practices you would want to share? How have you changed the ecosystem of the country? How have you helped create diabetes educators so that we can become the diabetes care capital of the world?
Sure. So I think thanks for asking this question, because we realized that there is this gap in in our care protocol in our country, that the physicians were burdened, number one, with so many people of diabetes, because we know that we are about 7 crore and plus number of diabetics, and similar number we are in the pre-diabetic stage. So the physicians are overburdened by managing these patients. And as we all know, that in diabetes, it is not only the drugs which are going to be effective, but it is the entire lifestyle change which is going to be important. Education, lifestyle management, as well as monitoring, all these things along with the drugs will help you to reach your goal. So when we realized that there is this gap about, say, 10-12 years back, we along with Dr. V Mohan and Dr. Shashank Joshi, we kind of instituted a national diabetes educator program, wherein 100 endocrinologists, even Dr. Kalra is one of them, and they were training paramedicals in order to become diabetes educators. So there is a program which runs every year. It is being running for the last 15 years. We have almost trained about 15,000 plus diabetes educators through this program, and therefore we have been able to achieve two things. Number one is that in a small way improve the care of the patients through these diabetes educators, and number two, capacity building and providing jobs to so many of these paramedicals who otherwise were not having this proper professional, certificate in order to manage, take care of the people with diabetes.
So thanks for that. So this is very important thing, capacity building. And Dr. Shashank Joshi and Dr. V. Mohan, they are the people who have led it. And Frida ji, in her characteristic style, actually, she is the one who worked very hard to get this off the ground. And how many years now, Frida ji, since this has
I
been
think
going on?
about almost about 13, 14 years.
Yeah,
Yeah.
much more than 10, yes.
Yeah,
And it's
yeah,
going
yeah.
strong.
Yes.
Is there still the same enthusiasm, the same zeal for training diabetes educators or for being trained as a diabetes educator as you used to see 12, 13 years ago? Or has it increased, worsened? What has happened?
Yeah, in fact, every year we kind of ask the same questions. Are we going to get, now there are two parts to it, right? One is the trainer. Will the trainer continue in this program again? And the number two is that will we get trainees in order to train them? And believe me that every year we have been proved wrong, because we get so many from both the sides. We get so many requests that people want to be trainers. And I think it is the passion of our, physicians of our country, to be a part of this care ecosystem. And because it is a very rigorous program, I mean, they have to spend almost 4 hours every Sunday, every month, and for about almost 10 months, in order to, and they have to give that time for this training. And yet we get these requests, so that is continuing. And number two is also that we do get paramedicals, and in fact many hospitals approach us that they want to train their nurses, their entire the nursing staff, so that they become competent in care for the diabetes patients. So yeah, I'm glad that this has continued over so many years, and it is gaining traction. It is beautifully gaining traction. Otherwise it would have not continued for so long.
And I think that is the way forward. If we want to become the diabetes care capital of the world, it's to say, एक एक बूंद से सागर भरता है. With each and every drop of water, you can fill the ocean. And I think that's the way forward. Each and every diabetes educator, one educator at a time, one city at a time. And then finally, you will see that that critical mass will be created. And then suddenly there will be a change.
Yes.
More people joining in and greeting you. Riddhi Desai ji hain, Anshu Singh ji hain, and also Billy ji ka ek sawal main leta hu. SGLT2 inhibitors should not be given if there are ketones in the blood. Actually, it will worsen disease. And we should ideally do a urine routine, urine ketone, before prescribing SGLT2 inhibitors. Krishna Kumar ji and Dr. Ayushi Gupta, artist Riya is there with us. And now a question. So, Dr. Utsav, we can get back to you offline. So now you have a potential training site in New Delhi. What do we do? Dr. Utsav Sahu would wants to join this NDEP, National Diabetes Educator Program.
Sure. So, doctor, you can share with me your, your contact numbers and all, and then my team in Delhi will definitely get back to you.
So we'll do that. Greetings and blessings for you, Farida ji, from one of our senior most physicians. Sir is Dr. N.S. Sharda, sir, who is based in Ahmedabad. So he sends you his blessings.
Thank you, sir. Thank you so much.
Vinay Gupta sahab कहते हैं that one area where we need help from the government and from healthcare professionals and from leading organizations like Indian Pharma, we need to spread awareness to reduce the usage of sugar, simple sugars and derivatives in foods and health drinks, because children are being put at great risk if they have unhealthy diet. And in the news also we mentioned 14 million people have diabetes just because they have chosen unhealthy choices. Food. So that's where we need help. So of course everyone has a right to advertise, but then just like other people have a right to advertise their food products and health drinks, we have a right to advertise good health. So any public awareness programs, Farida ji, that you've been conducting on TV, on Facebook, on Twitter, anything that comes to your mind?
Yeah, so we have been doing a lot of awareness, and simply because of the fact that, again, as we believe, and we have been leaders in in this country for management of diabetes for almost now 5 decades, and we believe that awareness is also one of the ways in which we can kind of at least make the people aware that first of all that they might be having diabetes, and number one, two is how to take care, and then obviously the lifestyle, diet, etc. So we do have a lot of Facebook shows on awareness, which is a continuous process. And if you go to our Facebook page of Beat Diabetes, Halt Diabetes, you will get daily, you will get physicians who will be coming and talking to you about how to take care if you are a diabetic, or how to prevent a diabetes. And we also do a lot of shows on media and the digital platforms in order to create awareness. This is our continuing program for the last so many years.
Any single program that comes to your mind, any single intervention where you found a sea change after you had done that? Anything that comes to your mind, any good practice?
So I think I can say two of them. That one is our television media program, which we feel that has also created a lot of awareness initiatives. And number two is our National Diabetes Education Program, which I definitely feel that it has, we have contributed to a small bit in this in the awareness creation as well as care.
Riddhi Desai asks a pointed questions. You've mentioned that we want to be the diabetes care capital of the world. Yes, we do. You've mentioned that patients should understand their rights as well and their responsibilities. Everyone has a responsibility. And then we identified the three responsibilities. First of all, accepting that you have a responsibility. If you don't take care of yourself, then who else will? And you can't depend upon your doctor or nurse all the time. The second is empowering yourself, learning more, finding out sources of information and then learning that information. And then the third is converting that information into practice. So actually self-management, self-care. So these are the three things. And then the fourth one we added was that if you're doing all these three, why don't you look after your fellow countrymen and women as well? Everyone in your family, everyone in your community. So Riddhi Desai ji ye puchti hain, apart from all this, anything specific that you would like to tell us? A baby step. Let's say I am at risk of diabetes. What can I start doing today to reduce my risk?
So I will tell you that I myself was also at a risk of diabetes about a couple of years back. I can say about 2 to 3 years back. And the first thing that I did was that obviously it was an alarm to me. And my physical activity was increased to an extent, as well as number one, and number two, my diet and my lifestyle. I kind of modified it. I did not reduce my diet, but I made it into a proper, well balanced diet in order so that I get back to normal, and now I am fine. So I think that these are the stuff that diet and exercise is very, very important, in order to take. And the mindset, we should have the mindset that all of us are going to live very long, because we see our parents living for almost about 85, 90 plus years of age. And if the incidence of diabetes is so high in our country, if we get diabetes or any such condition, chronic condition, early, then we have to live longer with the disease. And with that in mind, it is always better to prevent the disease from happening as much as possible through diet and life and exercise. That's what I would say.
So diet and exercise, these are two things. And then stress management also. Madam mentioned that.
Yes.
Dr. Vipin Mandula says that apart from taking care of yourself, you should screen. Like you said, you were at risk of diabetes. I'm also at risk of diabetes. So how do you find out? Only if you test yourself. And the best practice from Kangra district is that 8.3% of the population is screened every month at primary healthcare centers by ASHA workers, health workers, and community health workers. So thank you, Dr. Mandula, for doing that. And this actually helps spread awareness about diabetes.
Yes.
तनुजा जी क्वेश्चन पूछती हैं, so you've talked of diet and exercise and stress management, but would you be able to zero down on which is the most important for people living with diabetes?
Okay, so based on my experience, and I think Dr. Kalra can also share, his experience, because he has been working with a lot of more patients. I think every individual will have to find out his or her own, one very important risk factor. So, like, say for example, for some individuals, exercise is the one which kind of make sure that their blood glucose gets into the goal. More exercise, and for some it is the balanced diet and the way that you have your meals, etc., is going to support you. And of course stress is basically it is for everyone. So I think that I have found it, for me it is the diet and the stress which are the most important, which is kind of helps me to keep my sugars in check. So I think everybody will have to find out their own space. But I would love Dr. Kalra to take this question further and enlighten us about that point.
There would be no single answer. I think a little bit of everything. And then on KK Med Talks, many times we teach the S's. S for sensible sustenance, that means balanced diet. S for structured physical activity or exercise and sports. S for stress management. S for sleep hygiene. S for avoiding substance abuse. But then everybody has an Achilles heel. Achilles heel का मतलब क्या होता है? शरीर का वो वाला हिस्सा जो सबसे कमजोर हो, सबसे नाजुक हो. कृष्ण भगवान का भी अगर देखें तो उनकी भी कृष्ण हील थी, Achilles heel थी. Of course, कृष्ण भगवान came long before Achilles, but there was one part of his body which was weak, which was open to injury or to trauma. इसी तरह से अपने में देखें, some of us will benefit more from diet, others from exercise. ये जरूर कहूंगा that if you just follow a diet, you may lose weight and your glucose may come down, but you will also lose muscle mass. Muscles गायब हो जाएंगी. So you have to keep on exercising along with diet so that you don't lose muscle mass. Otherwise, you will end up getting a disease known as sarcopenia. So muscles weak हो जाएंगी, their function, their structure, their strength all will come down. So we need a little bit of both. Stress management, sleep hygiene. Now suddenly जो लोग सुन रहे हैं, many of us will realize, हाँ यार यहाँ गड़बड़ है, बाकी सब तो ठीक है, but I am not able to sleep properly. I am not able to manage stress. So then there are ways of doing that as well. Any ways in which USV has worked in the past on mind-body medicine and stress management? Anything that comes to your mind, Farida ji?
Yes, of course. I think that we have done the mind medicine program, and I think we have done almost about 2 years. And Doctor, you are a very, very integral part of that, and where and we realized that how important it is to you have your mind at peace, and which is then kind of affects the whole body as well as it and the conditions, whatever chronic conditions that you have. And those were very successful educational meetings that were conducted, and people who attended did benefit, and I am sure that they are practicing it in their chambers also.
Dr. Vaishali Deshmukh is an endocrinologist in Pune, a senior endocrinologist.
Yes.
And she spearheads this work on mind-body medicine in endocrinology and diabetes. And if you'd like to reach out to her to collaborate with her, she'll be very happy. She'll be more than happy to create networking, and so that we can all share best practices with each other. Two questions. One is from Raja Prabhakar ji. Madam, how does the pharma industry collaborate with patient advocacy groups to raise awareness about diabetes management?
Yes, so there are patient communities which are there, and and there are more of them in type 1 diabetes. There are many of them in type 2 diabetes also, and so therefore the pharmaceutical industry does a lot of collaborative programs with them, because those community, the patients who are a part of those communities are highly motivated, and as a result of which we leverage their enthusiasm and their commitment, and in order to share knowledge, share information with each other, and to educate more and more people with diabetes. So I think that definitely this collaboration exists, and it works very well.
Question from Hiral Bhatji. So Hiral कहती हैं कि in Tamil Nadu, the government has initiated the door-to-door healthcare policy. So do you engage in public-private partnerships? Are you working with the government in any CSR activity or otherwise to help improve healthcare?
Yes, so we are doing a program with Public Health Foundation of India, and that is in educating our physicians who have just kind of started how to manage diabetes, how to diagnose, how to manage, how to control complications, etc. So this program we have been doing for the last few years and it is a private-public partnerships. Yes.
Nilesh Agarwal ji also points out another best practice which has been supported by Farida ji, and that is the FIR, First Investigation Report, for police forces. So would you like to speak about that, Farida ji?
Yes. Yes, so we did this first investigation report, and we kind of did a detection camp for so many centers of the police personnel. and IGCP was our partner, and I think that they are also doing a wonderful job. All these small things that what we are doing throughout the country and throughout the year are, pieces in the ocean, or the bubbles in the ocean, which is going to definitely go towards improving the care. And there also in FIR program, we found so many people who did not know that they have got diabetes, and they were kind of detected as diabetes, and then obviously then they got into the management circle. Because as we know that 50% of the people do not know that they have diabetes unless and until they go and check themselves up. And I think that in USV, diabetes detection camps we have been doing for the last 5 decades. And so this is again one more area into how we are able to improve diabetes care.
फरीदा जी कहती तो हैं कि ये छोटे छोटे बुलबुले या बूंदे हैं पानी की, स्मॉल ड्रॉप्स ऑफ वाटर इन द ओशन. बट सच्चाई ये है दैट इफ यू जस्ट कीप ऑन डूइंग दिस, you keep on doing the right action with the right intention. The intention is quite clear. We want to be the diabetes care capital of the world. We want to be the diabetes control capital of the world. ये हमारी intention है, ये हमारा aim है. So the right action with the right intention in the right direction, एक ही रास्ते चलते रहें, and you do it consistently. So automatically you will reach your destination, which is good health, which is becoming the diabetes care capital. And ये सब जो छोटी छोटी चीजें हैं, they are done with the aim to improve health. They are not done with the aim to create a PR hype. So that is why many times, many of our doctors also who are listening now, they will feel कि ये तो मुझे पता ही नहीं था. The reason is that the people who are doing the work, they never try to advertise. They just focus on doing the work at ground level, and they keep on doing it. अब डॉक्टर भंडूला को ही लेते हैं. So much of good work going on in Kangra district in Himachal Pradesh. हमारा जो कांगड़ा है ना मैडम, this is famous in endocrine circles. So I'll tell you the history of Kangra and how it has helped our subject evolve as a very respected subject. For those of us in the medical profession, आजकल जब आप एग्जाम के लिए बैठते हैं, when you sit for the DM entrance exam, the toughest subject to get into is endocrinology. Out of the top 10 or 12 positions, 5 or 6 take up endocrinology. And let us say we have a total of 80 seats. By 85th or 90th rank, the seats are finished. Nobody leaves the seat, whether it is a free seat or a paid seat. And the credit goes to many people, of course, including diabetes awareness. But Kangra district was famous because it was the site of a study for iodization. So Kangra Valley study hui in the 1960s, where they took one village and they iodized the salt in it. And they did not iodize salt in the neighboring village. And what they found out was after a few years, goiter had been eradicated in that iodized village. So this Kangra Valley study was the first study which actually led to endocrine advocacy, iodization of salt. The government made iodization mandatory. Goiter, iodine deficiency is almost eradicated across the country. And जो हमारे colleagues हैं public health के, जो हमारे colleagues हैं जैसे डॉक्टर बंडूला हैं who actually work on the ground, and जो endocrinology वाले हैं, all of us we can bask in that glory कि actually हमने बहुत अच्छा काम किया 50 साल पहले. जब भी हिस्ट्री लिखी जाती है एंडोक्रिनोलॉजी की, उसमें कांगड़ा वैली comes right at top. So Dr. Bandula, thank you for continuing that legacy as well.
Thank you sir, thank you.
And अच्छा, डॉक्टर बंडूला का ही मैसेज है, लंबी उम्र रहेगी सर की. He says that the ASHA workers fill community-based assessment checklist, okay, and refer patients to PHC, where free diagnostics, free medicine, and teleconsultation is also available. तो ये एक पॉइंट आता है. एंड देन लेट्स आस्क यू अ क्वेश्चन मैडम. अब डॉक्टर विपिन सेड कम्युनिटी बेस्ड असेसमेंट. सो diabetes, is it a disease of the individual, of the family, of the community, of the country, of all of the above? What's your take on this?
Yeah, I feel it is a one person. I'll tell you opposite way. If one person in the family gets diabetes, then, and if they take control of their life very effectively, then the whole other people in the family are also follow the very healthy way of living. I think I don't know the question to whether it is if it is a disease of an individual or a family or the whole community, but I feel that one person gets it, they take care of it, then the whole family benefits from it. Because of the fact that they live a healthier lifestyle, because I feel that the lifestyle which is propagated for a person with diabetes is the most healthiest lifestyle that anybody can have. So I think I want to answer the question in that way. Yeah.
And in Kangra, they continue to do salt testing. The ASHA workers have got a salt testing kit, so they see whether there's adequate iodine or not. And so
Okay.
Kangra is continuing to work on that. That is actually very heartening to hear, sir, Dr. Bandula, sir. He also mentions that they have health melas at the district level. And on the 14th of every month, they organize a Cycle for Health, cyclathons, another good way of spreading awareness and encouraging physical activity.
Sure.
Speaking of health melas, actually one of the pioneers in the country was Dr. K.K. Agarwal, sir. Uh, it is sir's legacy that we are all actually enjoying today. KK Med Talks is his legacy. And he used to conduct huge health melas in New Delhi. And that led to understanding awareness about diabetes, heart disease, blood pressure control. And that actually helped us a lot. Some more questions coming up, Farida ji, if you allow.
Yeah,
जो
sure.
जो क्वेश्चंस हैं जैसे डॉक्टर शिवलता भी एक्नॉलेज योर क्वेश्चन ऑन dapagliflozin. Please allow us to take that in a separate KK Med talk. We can speak about different drugs. विनय गुप्ता जी योगा के बारे में पूछ रहे हैं. The answer is yes, it is a good adjunct therapy. Alone maybe it will not help, but as an adjunct it helps. Apart from all the other benefits that we know about yoga, flexibility, stretchability, balance, it also makes the autonomic nervous system healthy. So sometimes you will see that in today's world, in the fast-paced world, there is an autonomic disbalance. Sympathetic system जो है वो बहुत hyperactive हो जाता है हमारा. हम राजसिक मोड में चल जाते हैं. If we were to speak in Ayurvedic terms, we go into rajasic mode and we forget the tamasic mode. When you read books written by the management gurus, तो सब कहते हैं जी action, 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 rest बिल्कुल नहीं करना. वर्क लाइफ बैलेंस की बात करो तो जवाब आता है जी वर्क लाइफ इंटीग्रेशन, एवरीथिंग शुड कम टुगेदर. तो तामसिकता is considered bad. That is, parasympathetic is considered bad. Sleeping is considered sinful. कि काम क्यों नहीं कर रहे आप? This is true for the medical profession as well. So actually, what yoga does is it restores that balance of sympathetic and parasympathetic, or rajasic and tamasic, and it brings me into sattvic or euautonomic mode. साकिब जी कॉमन मिथ्स के बारे में पूछ रहे हैं. Allow us to take that on a separate day. And some questions coming in. एक तो तारीफ हो रही है मैडम for a question for one of your employees, and his name is Mr. Sachin Chanshur. So Shrishti ji and other people and the kid praising the program on endocrine awareness and diabetes awareness that is spearheaded by Mr. Sachin from your company.
Yes, definitely. Yes, thank you.
Question from Mr. Hari Narayana. तो साहब पूछ रहे हैं, how do you see the pharma industry evolving to meet the challenges of diabetes management in India, the next 10 years or so?
So the next 10 years or so, the way that I look at it is that the pharmaceutical industry will have to view the person with diabetes as a whole, and not only from the point of view that drugs is going to cure. So I think that we'll have to take care of the entire his ecosystem, as to how is he kind of living in that ecosystem, and how can we make the ecosystem much better to stay. So I think that is where it is going to go, and it is not going to be restricted only to drugs. That is what I feel.
When COVID started, there was this very nice Punjabi song. I cannot forget the singer. I cannot remember the singer right now. But what he said was, Rashi ale hun Rashi nahi padde. The astrologers जो राशि पढ़ते थे पहले, and so they would spend so much time predicting the future for you, उन्होंने राशि पढ़नी बंद कर दी because nobody knew the future when COVID struck and all of us were in lockdown. So if you could put on your astrologer hat, so अगर आप राशि पढ़ते हैं इंडिया की, and here the question being asked to you, can we, will we, shall we become the diabetes care capital of the world?
Yes, I think that is definitely a reality. But again, as I said, that each and every one of us have to take ownership of this, of ourselves, and otherwise, it is going to be. It is not going to be impossible, but it will take a longer time. Only that I can say. So I think each and every person living with diabetes or with pre-diabetes, we have to get our act together and then take care of ourselves.
So point well taken. We can become the diabetes care capital of the world. We can become the diabetes control capital of the world. At an individual level, we have to take charge. तो पहले हमें समझना चाहिए कि हमारा जो फ्यूचर है, हमारी जो तकदीर है, जो जो हमारे कर्म हैं आगे वाले, वो हमारे ही हाथ में है. Not anywhere else. We have to take charge. So that's at an individual level. And Dr. Shubhlata Chitwal Madam adds that empowering the general public at a larger level, that is a very good step to fight this menace. And then we have seen best practices coming from you, what the pharma companies have done, what USA has been done quietly, has been doing quietly over the past 5 decades. And then we also get best practices from Kangra district, from Himachal. On the ground, they are actually working very hard to make us the diabetes care capital. I was wondering, is there, like we have so many awards in endocrinology, we have awards for individuals, for best endocrinologist, for best researcher. I was wondering if we could create something create a best district kind of an award. And then
Yes,
I
that'll
would
be
vote for
wonderful.
Kangla. We would vote for Kangla. But actually, that would be very nice,
It will motivate a lot of
it
people.
will motivate. Yeah. So we should be able to find out and highlight best practices going on across the world.
Yes,
I would also
absolutely.
like to say कि सब लोगों की जिम्मेवारी है. अगर सबके हुकूक हैं तो जिम्मेवारी भी सबकी है. Whether you are a general physician, a diabetologist, somebody in public health, somebody in health organization like Dr. Vipin, somebody in endocrinology, maybe someone working in healthcare sector like IJCP group, सभी की जिम्मेवारी है to make us the diabetes care capital. And सभी को equal श्रेय भी मिलना चाहिए. Everybody should get equal respect and acknowledgement also for all the hard work that they are doing. In fact, you will find that some of the most selfless work will be done by the people who get no recognition, the ASHA workers, for example. अब डॉक्टर मंडोला को देखो, उन्होंने एक बार भी नहीं कहा कि मैं ये करता हूँ, मैं ये करता हूँ. He never said, I do this, I do that. He has been continuously speaking about his workers, his ASHA workers, his community health workers. So that is the spirit, I think. That is teamwork, actually.
Definitely. You're doing some great work, Dr. Barula. Yeah.
एक क्वेश्चन रहेगा. We spoke of modernization. We spoke of hyper sympathetic activity and things happening which are not very conducive to health. That's why we have to step back and take a break. Dr. Ayushi Gupta says pandemic increased diabetes. Yes, because of biomedical reasons. COVID directly impacts the beta cell, and COVID also increases insulin resistance. कोविड की जो बहनें हैं, जो जैसे मर्स या सार्स, जो बाकी वायरस हैं, they are known to be diabetogenic, pre-diabetic states. So it is expected कि कोविड के बाद भी diabetes बढ़ेगा, and already we are seeing that. So this is biomedical. Another biomedical reason, Dr. Ayushi, is that some of the drugs that we used for COVID, like steroids and vasopressors, they increase hyperglycemia. And then psychosocial issues, of course, so much of psychological stress, social stress, financial stress. Though thankfully much of that is behind us, but it does leave an impact. चाहे वो temporary social या financial stress था, it does have an impact on glucose levels. One last question, madam, if you allow. हम बात करते हैं of healthy living, healthy lifestyle. What is the credo of USV? You are famous for your special C's.
Yes.
And how can we use those C's? अगर आप एक एक करके हमें पढ़ा दें, अगर उनको मैं अपनी पर्सनल लाइफ में, अपनी प्रोफेशनल लाइफ में इंटीग्रेट कर दूं, if I can integrate them into my personal and professional life, perhaps my glucose, my blood pressure, my cholesterol, everything will improve.
Yes, I think that, yes, that's a very wonderful question, Dr. Kalra. And those of us who have been in US, we have been living our credo values not only in professional life but also personal life. So I can tell you for diabetes, one of our credo is a very important credo is collaboration. And I think in diabetes, without collaboration, it is just not possible to kind of get to your goals alone. And you need the collaboration of your family members, you need the collaboration of your physician, of your diabetes care workers, even of your friends, family, and so on. So that is one. Another credo is cheerfulness, and cheerfulness, as we spoke so much about stress, and so therefore that stress, and you have to be cheerful. So obviously adversities will come. Life is not a bed of roses, but how you kind of take charge of that, and yet overcome all these hurdles, and don't take stress upon your undue stress upon yourself, is what we kind of say. That is one of our credo. And another credo is communication and taking on challenges, which is extremely important, that. And diabetes, it will become a challenging condition only if we don't take care of ourselves. And it is a challenge, and I think that each and every one of us can overcome it. So these are some of the credos that we have with us, and they very well correlate with how we can kind of take care of diabetes. Yeah.
Let's repeat some of what Madam has said. एक तो है collaboration. If we want to become the diabetes care capital of the world, we need to collaborate. सबको इकट्ठे लेके चलना है. We have to work together. दूसरा है कमिटमेंट. कोलैबोरेट तो किया, पर किस चीज के लिए? कमिटमेंट भी होनी चाहिए. You have to go in it for the long run. So we have to be committed towards achieving our goal. मेरा जो पर्सनल गोल है, दैट इज टू मेक द वर्ल्ड अ हैप्पियर एंड हेल्थियर प्लेस. मतलब इतना ही है, इससे ज्यादा भी नहीं है खास. दैट्स ऑल आई वांट, फरीदा. तो थोड़ा थोड़ा लगे रहते हैं, कभी कभी गड़बड़ भी हो जाती है, फिसल भी जाते हैं, बट देन कमिटमेंट मीन्स के फिसल गए तो थक गए तो कोई बात नहीं. यू रिचार्ज योर बैटरीज एंड देन यू कम बैक. एंड दिस पंजाबी सॉन्ग आई रिमेंबर, बैटरी चार्ज रहती है 24 घंटे, तो बीच में सोना भी होता है 8 घंटे, बट देन यू रिचार्ज फॉर द नेक्स्ट डे. सो कोलैबोरेशन विद कमिटमेंट. दूसरा है कम्युनिकेशन. यू हैव टू स्पीक विद ईच अदर. दैट इज अ क्रेडो ऑफ यूएसवी. And while you're doing it, you might as well be cheerful. जब communicate कर रहे हैं तो एक smile भी तो दे दें. So thank you, madam, for smiling.
Thank you.
And one other credo that USV has is customer orientation. तो यहाँ पे कस्टमर की तो बात नहीं करेंगे, बट एक दूसरे के साथ कलीग की बात करेंगे. We are all colleagues, we are all in it together. एक दूसरे को समझें, जानें, and try to understand, try to empathize with the other person, जिससे भी बात कर रहे हैं, जिससे भी आप connect कर रहे हैं. I learned a new English word also a few months ago. So एक तो होता है sympathy, एक होता है empathy, और एक होता है compathy. Sympathy, of course, is, hi बेचारा तुझे sugar हो गई, that kind of a thing. Empathy is, I can think the way you are thinking. So in my head, I know what you are going through. Compathy means my heart feels the way you are going through. And जब यूएसवी में बात की जाती है कस्टमर ओरिएंटेशन की, तो ये एक्चुअली कॉम्पैथी प्रैक्टिस कर रहे हैं. दे आर प्रैक्टिसिंग कॉम्पैथी विद चीयरफुलनेस एज वेल.
Right. And I think, and I can add one here to correlate our credo of customer orientation to diabetes. That customer is, of course, is a customer, but treat yourself as a customer. And how would you take care of your customer? That is how you will want to take care of yourself. So orient yourself to what you need, what your body needs, and treat them like how you'd have treated your customer. So I think that is how I'll also put it.
And of course, there is one more C that Madam has not mentioned. That is C for challenge. But then resilience. Yes, अगर भगवान ने आपको challenges दिए हैं, तो भगवान ने आपको कंधे भी दिए हैं, shoulders भी दिए हैं. And God is quite good at sort of measuring the kind of challenges that you can handle. So if you have challenges, you also have strong shoulders, and then you have strong colleagues to help you handle those challenges. Another best practice coming from Himachal, and this is from Dr. Vipin Mandula, and also Professor J.K. Mokta from Indira Gandhi Medical College, Shimla. They have been successful in getting the Himachal Pradesh government to provide free insulin pumps to children with type 1 diabetes. And I think the same is true for Rajasthan as well. You need an endocrinologist prescription, but Rajasthan also gives free insulin pumps now. So this is very good information.
Yes, very nice. Good work. Yeah.
I'd like to thank everyone who has logged in today. Nakul Gaushala Wale ji bhi hain. Thank you for being with us. And thank you for all the best practices that you've shared with us, everybody. Like we said when we began, Farida ji is an icon in diabetes care in India. Everyone in diabetes care knows her. She's been leading from the front very quietly for decades of age, but we are the same age, so let's put it that way. Decades. But she's been working quietly behind the scenes, leading from the front, from the back. And ये जो सब क्रेडोस की हमने बात की, चैलेंज तो कुछ भी नहीं है मैडम के सामने. कस्टमर या कोलीग ओरिएंटेशन, कोलैबोरेशन आपने देख लिया, and I'm sure you would have got a feeling of the commitment that she brings to the table. And communication and cheerfulness, वो तो दिखता ही है. एक्चुअली यही क्रेडोज हैं केके मेडटॉक्स के, फार्मा टॉक्स के, एंड यही क्रेडोज हैं आईजेसीपी ग्रुप के. So when we all get together, I'm sure we'll be able to achieve what we've aimed for. So Farida ji, thank you so much for being with us. We have Pratik and Pooja with us backstage. Could you please show a certificate of appreciation for Madam, please?
Oh, and thank you so much for inviting me for your talk shows. Thank you, Dr. Kalra. Thank you, Nilesh and IGCP Group. Thank you so much.
Thank you. So before we
Really
conclude,
honored to be on your platform. Yeah.
Oh, we are honored actually. The honor is ours. One last message for everyone before we leave.
Yeah, so one last message I must say that, you know, as we were saying, that life is not a bed of roses, but there is always a solution to every problem, and that too the problem can be done with by being cheerful. So don't fret about it, and each and every person living with diabetes can lead a normal life. You have to just own it and take care of yourselves. I think God bless you. Take care of yourselves. Thank you so much. Thank you.
It is. Thank you, Farida ji. Thank you, everybody. आपको एक हैप्पी ईद आ रही है विनय गुप्ता जी से.
Yes, thank you so much. कल हमारी ईद है. Thank you very much for that.
So ईद मुबारक एंड सबको बहुत-बहुत शुक्रिया, धन्यवाद, मेहरबानी for logging in. KK Med Talks is there every day at 7 p.m. I'll be with you Monday and Thursday. अगले मंडे के लिए इजाजत दें. I'll take an off. I'll be traveling. मगर अगले वीरवार आपको दोबारा मिलता हूँ with a special topic, a special guest, a special show as always. Thank you and Jai Hind.
Thank you. Thank you, everyone. Thank you.